Good afternoon, everyone. I'm County Judge Dan Hicks. I have Dana Hartman with the health unit here and Ella Helms from the hospital with me. We're going to go over some things today and address some rumor control, and we have some questions that we're going to answer. But we're going to start with our daily update. The state of Texas has had 88,649 tests. There are 161 counties reporting out of 254. Yesterday it was 157. Cases reported is 8,262. It's 1,000 more than yesterday. Currently, there are 1,252 in the hospitals, and that's up about 100 from yesterday. Fatalities statewide is 154, and yesterday it was 140. In Scurry County, we've had 17 tests and 11 negatives and 6 pending. So we still have no cases in Scurry County as of now. So we're going to start with some rumor control. And we've been hearing rumors that are flying around out there that there's a case here, or we're not telling somebody that there's a case, or there's a case somewhere else. I'll tell you right now, if there is a case, we will tell you. You'll hear it from one of the things, something that we want to do. We want everybody to be as informed as possible. Either of you want to address anything on that?
One thing I think people may not understand is the different levels of accountability.
Mm-hmm.
For example, the hospital is running the test, they result the test. But in addition, you've also got oversight from the Department of Health. You're informed regarding any test results. And furthermore, the lab vendors that we send the testing to report directly to the Department of Health. So there's multiple layers of people who are looking at those results and who will be notifying people. One of the things that we've pledged internally to our employees is if and when we have a positive, you will hear it from us, we will tell you. The same thing for the community. If and when we have a positive, we will let you know. And that's the only assurance I can give anybody right now.
Yeah, that's great. That's
and
great.
we do not report until we absolutely have those numbers in hand. Because if we have pending cases, we don't go with, well, it's suspected or anything like that.
That's a good point.
And that's one thing that we do. We actually have that in our hands before we actually report anything that we have. Our numbers that are updated every day, those are hard numbers that you receive, and that's what we give to the county.
Right. So
I think another thing that helps in that regard is the fact that our turnaround time has decreased.
Sure.
So when we're getting our results back so much more quickly, I think even the public has an awareness when you look at our daily number of how many are processing through. So knowing that we're going to get that improved turnaround time, that means we're going to have those results. They'll be in your hands. They'll be in the physician's hands in a timely manner. And there's really absolutely, I don't think, any reason to go ahead and give anybody something that's presumptive when we know if we just wait another 24 hours, we will have hard and fast results.
Right.
Exactly.
Yeah. So that makes me think of another myth or rumor that's been out there, is that a positive test takes longer to get back than a negative test. Now, I don't know why that came up. I think there was an article out that said something about that. So that's not the case, though. We're not going to get any kind of result back from the lab, especially if the lab is backed up as much as they have been. I know the state, their restrictions or their requirements are a whole lot higher than the private labs are. And most of ours have gone to the private labs, and the longer they take, it's because they've backed up that much further and further. It's not because it's a difference in positive or negative.
No, once they run that test, whenever they go into the lab to run that one test, it's either a positive or negative right there.
Right.
There's not they test and then retest. Once it hits that lab, you have your result.
Right. Okay. All right. One of the questions was, why was there an increase in the tests performed? Who wants to answer that one?
I think partially because the testing criteria was relaxed a little bit. And obviously over the last 24 hours, we've had an increase in the amount of testing for people who met that relaxed criteria.
Sure. Okay.
Right. Whenever the testing first began, it was with strictly the state labs. State lab was the only one, and we started out honestly with 3 in the state of Texas at that time. You had strict guidelines, and they would not test. Now that we've had commercial labs come on board, that has given us more opportunities because the state is still staying with those strict guidelines. So they have a certain test that they will run or a certain patient. You have LabCorp, you have CPL, you have other labs, commercial labs now that don't have such stringent rules. So we can go ahead and we can submit more testing.
Okay.
So
Yeah.
that's another reason why we actually have more of an opportunity
Mhm.
with 2 more commercial labs coming on.
Right. And you said some of the restrictions are relaxed. So, such as initially when they started testing, it was if you came from a hot spot from another country, and then it got to where it was a hot spot from another state, and now I'm assuming it's a hot spot from another part of the state. Or
It's basically a case by case basis because right now we would consider Lubbock a hotspot
Sure.
ourselves, and it really depends on where you're geographically located.
Mhm.
So it really is. We look at each individual differently. We look at each case. We look at their history of travel.
Right.
We look at their other symptoms, and if they do fall or meet most of that criteria, we will go ahead and test them if
Okay.
needed.
Okay.
So that's basically where it comes from.
Good. Well, that makes sense to me. So, and you had some questions that you've received that you wanted to address, correct?
Yes, I did have some questions from Facebook. The first one is, what do I do if I think that I've been exposed? And whenever you think that you've actually been exposed to a known case means that someone that has actually been tested and actually has been proven positive. That's a known case. If you think that you have, we are asking you to self-monitor.
Mhm.
Stay at home, take your temperature twice a day, monitor yourself for symptoms. If you do become symptomatic or if you have questions, you need to contact your PCP and let them walk you through what they need as far as your plan of care goes.
Okay.
So that's part of the second question is, what is the process if I get tested? That's an excellent question.
Sure.
Right, family or whoever lives in your household or your close contacts, we request them to be quarantined also. And until we get those results back, we want to make sure that we keep limited access as much as possible. We ask those family members, as the one that's been tested, we try to keep them segregated if possible. That's not always
Sure.
that's not always
Right.
possible in a home. That we ask them to try to quarantine themselves away from family members. Family members need to be doing the same thing. They need to check their temperature, see if they have temperature, shortness of breath, any respiratory issues, anything like that.
Okay.
So what we do at the health department is, if once someone is tested, we will follow that case, and that case will either be negative or positive.
Right.
And thank you, Lord, right now we're at zero zero positives.
Right.
If we do have a case that is positive, what we will do, we will take that person and we will begin what is called contact tracing. And what that amounts to is anyone that person has come into contact with for the last 2 weeks. We will basically start and work our way backwards to find out if you've been to Walmart, if you've been to the grocery store, if you've been around your grandkids, or anyone like that. And I want people to really think about this during this time, because if something happened, if you were to become positive today, have you been around 5 people or have you been around 50 people?
Right.
And so that is the process, and that's what we will do. We start with basically patient 0 or that positive case, and then we will work our way out.
Okay.
And if anyone needs to be tested, if they become symptomatic, then they will be concurrently tested.
Okay. Well, that ties into something that we talked about before, is your investigations. You said you have a lot of investigations going on. You've done a lot of investigations,
Yes.
Which doesn't correlate with the number of tests that we've done. So
Exactly.
that makes me think that it hasn't been cases that have turned into COVID-19 cases. It could have been the flu or a cold or something, some other type of respiratory illness or something like that.
And that is exactly what's going on. We're at that time of year. We have flu. We have a ton of strep.
Yeah.
We have allergies. We have all of these other things that mimic the same symptoms.
Right.
So that's what we have to go through in part of our investigation. Okay. So we basically kind of walk them through. And the big tip off has been the history of travel.
Sure.
Or the known case.
Okay.
because as I said, it's a case by case basis.
Absolutely. Okay. All right. Well, what was your next question?
Let's see. The question 3, the TDCJ LEC.
Mhm.
As far as the LEC, I was going to refer that back to you.
Yeah, they're not testing, but they're monitoring them. Monitoring. I think we've worked with the hospital to get to where if they want to, they can, if they need before shift, they can go and get tested before they come on the shift to stop the spread that way.
Okay.
That's my understanding is what they've started doing now. As far as TDCJ goes, I talked to the warden a while ago and talked to him about the what they're doing. The TDCJ is testing. There are no cases out here at Daniel Unit. There are cases in the prison system, but there's none around here. If you want any more information about what TDCJ is doing, you can go to the TDCJ website and you can see what they have. They also put out a lot of great videos. I've looked at some of those, and they are putting out a lot of good information. So.
And the last question, we had some really good questions, and we really
Mhm.
appreciate the public. If you have questions, that's what the health department's here for.
Sure.
You know, that we are here to educate. The last one, are we still inspecting restaurants? Because everyone thinks, okay,
Mhm.
there's not a dining room. Absolutely. We are still inspecting restaurants daily. We're keeping up with them. We're making sure that they're still following all the proper procedures.
Mhm.
And I really want to say thank you to them right now, because this has been a really tough time for our restaurants and for our other businesses.
Absolutely.
It really has. They have done their best to be as creative as possible.
Mhm.
And the only reminder that I have for them and for all of the businesses is be sure that you have one person handling your money,
Right.
gloved up, handling your money, and another person that is actually handling the product.
Mhm.
That's the main thing. Is you really don't want that cross contamination
Right.
going on, which that's a good practice whether we have coronavirus going on or not. That's just
Absolutely.
a really good practice to get into. We did have someone ask us if we were requiring the delivery people to wear the mask and wear the gloves. It's not an actual requirement
Right.
right now, but we are asking them to.
Okay.
But we do know masks and gloves are in short supply,
Mhm.
and we want them to be smart about the way they're using the supplies that they do have.
Absolutely. Yeah.
Yeah.
And there are people that are making masks,
There
so
are.
they can, I bet they can find those on Facebook or one of the other social medias to see who is making them. I have something that the city has asked me to mention. The landfill, due to current circumstances and the limited number of customers and citizens that utilize the landfill on Saturdays, the City of Snyder landfill will only open on the first Saturday of every month from 8 a.m. to 12 p.m. If the landfill is not able to open on the first, get to my other page, Saturday of the month, if they're not able to open on the first Saturday of the month due to severe inclement weather or other circumstances, it will open on the following Saturday. They'll be open 8 a.m. to 12 p.m. on holidays, except for New Year's, July 4th, Thanksgiving, and Christmas. Now, that's not saying they're not open during the week. That's just saying that on Saturdays, just that one Saturday. So if you need any more clarification, you can contact the city at 573-8826 or 573-4960. I just want people to remember to be safe. The main thing I want people to get out of this today is the rumor control. If they don't hear it from us, it's a rumor. It didn't happen. It's not happening. We're not going to lie to you. We're going to tell you if there are any cases. As soon as we know, the general public will know. Okay?
Can I add one more thing
Absolutely.
to some of that, Dan, which I hope is a form of reassurance for the community? This morning, I read a report from the Office of the Inspector General. It was commissioned on behalf of the U.S. Health and Human Services Commission. And when I read through the report, all hospitals, all communities are going through what we're going through.
Absolutely.
There's a shortage of PPE. They're worried about staffing. They're worried about screening. They're worried about primarily, I can't get enough testing. It's not just Scurry County.
Right.
It's everywhere. It's everywhere in the United States. So in that regard, this is no different than what everybody else is experiencing. And in some regard, after I read that report, I actually felt pretty lucky about what we do have in place. there are a lot of hospitals and a lot of communities in a lot more dire circumstances than we are.
And I just
Absolutely.
wanted to say the same thing. We in Scurry County are extremely lucky to have the group of professionals that we do.
Mhm.
For us to have the small community that we do, our hospital, our first responders, the team that we have working behind the scenes, people have no idea. This has been 24/7.
Yes.
Since day one. And there are a lot of people that I really appreciate and I have a newfound respect for
Yeah.
through all of this because we are all in a learning curve right now.
We are.
And I could not ask for a better team to be working with. And I just want our community to trust us enough to not let the rumors get away with them
Right.
because it's very easy to scroll through Facebook. Oh
Mhm.
my goodness, did you see this?
Right. It is.
And so it's just I want people to understand that they have an excellent team that's looking out for them.
I agree.
Oh, I definitely agree with both of you. We have a fantastic EMS, health unit, hospital, police department, sheriff's department, everybody who's been working in this. And, that extends even further because we have the daycares, we have people that work at all the grocery stores, the
Mhm.
Walmart, everybody that is still working to keep our community going. And I hate to use the term non-essential because everybody that lives and works in this community is essential. So I don't like how we've had to
I
do
don't
that. It's so hard. But everybody needs to be thanked for coming together and doing a great job to lift up and drive our community and our economy. So thank you both for coming in today and being here. It's a lot of good information, and I hope that the public takes it and understands that we're the ones who will give them the information. Stay away from the rumors.
Exactly.
Thank you.
All right, thank
you.
y'all. Awesome.